Hey, how are you doing? We've already discussed in this channel how to address incontinence problems, whatever they may be, as well as diaper changing in an older person. Today we'll focus on the bladder. Over the years, this hollow organ loses elasticity, which reduces the amount of urine it can hold. If we add to this the fact that the pelvic floor muscles are weakened, the result is that they are not completely emptied. You have to go to the toilet more often, and urine leaks appear. But let's see now frequent bladder problems. We are talking about very well localized problems, but they affect many facets of life. Bladder conditions cause some people to inhibit certain social activities and make it difficult to perform tasks at home or at work. There are three most frequent problems. The first is urinary tract infections, which are the second most common type of infection in the body. More than half of all women will have at least one such infection in their lifetime. Weak bladder muscles keep the bladder from emptying completely, and when urine stays in the bladder too long, infection is more likely to occur. The most common is the bladder. Bacteria enter the bladder, causing symptoms such as sudden and uncontrollable urge to urinate. These infections can spread to the kidneys. If this happens frequently, or lasts a long time, it can cause irreversible damage to them. The least common infection is that of the urethra. The second common problem is lower urinary tract symptoms, which include problems with urination, loss of bladder control, urine leakage and the need to urinate frequently. They are all attributable to the bladder, urethra and pelvic floor muscles. The third problem is bladder cancer, which is much less common than the others and occurs in the lining of the bladder. Let's now look at what factors can increase the risk of having any of these problems. Or, in other words, let's see what can affect bladder health. We can't control everything that affects bladder health, but we can control certain behaviors that affect our health. Let's see how the following factors affect our bladder. Constipation. The accumulation of stool in the colon can make it difficult for the bladder to expand and ultimately alter its normal functioning. Diabetes. It can damage the nerves around the bladder that help control it. Overweight. It increases the chance of urine loss. Little physical activity. An adequate level of physical exercise prevents bladder problems, as well as constipation, and helps maintain a healthy weight. Smoking. Bladder problems are more common in smokers, and the risk of bladder cancer increases. Certain medications. Some medications can promote urine loss, some that are taken to calm the nerves or to fall asleep are known to numb the nerves of the bladder, and consequently, not feel the need to go to the bathroom. The alcohol. Many people have bladder problems that are worse. The caffeine. It can alter the perception of when to go to the toilet. Diet. Some people notice how soda, artificial sweeteners, spicy foods, citrus, juices, or tomato-based foods make the problem worse. Pelvic injury. Any damage to muscles or nerves, whatever the cause, surgery, childbirth, trauma, will alter bladder control. Sex, yes, because sexual activity can move bacteria from the intestine or vaginal cavity into the urethra. Urinating after sex decreases that risk. Urinary probe. It can be a great way for bacteria to go into the bladder. I leave above the link to the video where we talk about urinary catheter care. Let's see what symptoms alert you to a bladder problem. The most frequent are: you're leaking urine, you wake up many times at night to urinate, you suddenly and urgently feel the need to go to the bathroom, you feel pain or burning before, during, or after you urinate. You see that your urine is cloudy or bloody. You urinate little in relation to the desire you had. You experience difficulty in starting to urinate, or the stream is weak, and it is difficult to empty your bladder completely. These symptoms are generic, but because of their importance, let's look at the second most common type of infection. Despite the above, in older people, mental changes and confusion may be the only symptoms of a urinary tract infection. It can be accompanied by tiredness, tremors, weakness, muscular and abdominal pains, a fever that is not very high, below 38.3 degrees Celsius, cloudy, bloody or smelly urine, pain or burning when urinating, and an urgent and frequent need to urinate, even shortly after emptying the bladder. Instead, if the infection has spread to the kidneys, symptoms may include chills and shaking, night sweats, feeling tired or sick, fever above 38.3, pain in the side, back or groin, flushed skin, possibly also warm, mental changes or confusion, nausea and vomiting, and even very severe abdominal pain in some people. Sometimes you can have bacteria in your bladder or urethra without any symptoms, which is known from a urine test. In these cases, it is up to the doctor to decide whether it is worthwhile to treat with antibiotics. Talking about these issues is likely to be sensitive. We have already discussed in this channel how to deal with this kind of issues, and here is the link. Here we will see what to expect once you have taken that important first step, that of mentioning that you have a bladder problem. Most likely, after the doctor asks a few questions to guide the diagnosis, he or she will perform a physical examination. Women will most likely have their pelvic area examined. In the case of men, this examination will also include the prostate, which must be accessed rectally. As a complementary test, your doctor may order a urine test to see if there is an infection in your bladder or urinary tract. The doctor may need to use a cystoscope, a long, thin tube that is inserted through the urethra to examine the bladder. The doctor may even perform a test by filling it with warm fluid to see how much is leaking. Finally, an ultrasound may be done after urination to see if you empty your bladder completely. Treatment may include behavior and lifestyle changes, exercise, medications, surgery, or a combination of all of the above. But in most cases it's just a urinary tract infection that usually goes away with the right antibiotic. Drinking plenty of water and urinating often is sure to contribute to early improvement. The pain may require some pain relief, and a heating pad or blanket. That's all for today. I hope I've been helpful. In any case, thank you very much and see you in the next video.